So now let's talk about, this is Abigail with Medicare with Jake, and I want us to talk about today Medicare Part D prescription drug plans and their costs. The different phases of cost. How do you pay? What do you pay? What does this mean? I've heard a thing called the donut hole. It sounds like a delicious treat, but is it really when it relates to our Medicare? So let's talk about prescription drug plans and the different phases of payment. So prescription drug plans, that is your Medicare Part D. Just again, think D for drugs. That's the easiest way to remember these plans. And there are really 4 phases or stages of payment with these plans. The first one is your deductible. Not every plan is going to have a deductible, so some might only have 3, but in theory there are 4 stages. And if your plan has a deductible, the Medicare maximum this year as of filming is $480. So no plan can charge more than $480 deductible this year. So with that, you would have to pay the cost of a medication before it actually gets covered or partially covered by your plan, depending on the medication and the tier it's on. Medicare prescription drug plans have 5 tiers to them as far as where a medication lands. You've got your preferred generics, your generic, your preferred brands, non-preferred brands, and then specialty medications. And as you can imagine, the higher the tier, the more expensive the medication is going to get. Those tiers are going to vary from plan to plan, company to company, medicine to medicine. So there's no real exact science to every plan has this medicine on a tier 1 or a tier 2. There's some general rules, but again, this is why working with an advisor is so important, because there are a lot of moving parts when it comes to our prescription drug plans. So our first phase, that's that deductible phase. We've got to pay that deductible if there is one before the plan's going to kick in and assist with any of the cost. Then we get into our initial coverage phase. Now during this phase, this is between that deductible of $480 and up to $4,430. That is as of filming the number that we're at with Medicare. That is not how much you have to spend. So that number is really scary for people. That is a combination of your copay, so whatever you're paying at the pharmacy counter, plus what the medication actually retails as cost. So they're combining those two together. It's what the drug costs plus what you're paying. As you go through each month, every 90 days, whether it's mail order at a pharmacy counter, as you're getting your medicines, those numbers are being added up. If you hit that $4,430, we are now going to hit the coverage gap. This is also lovingly called the donut hole. So if you've ever heard anyone talk about hitting the donut hole and wondered what in the world is that and what does that have to do with Medicare, this is what they're talking about. This is specific to your prescription drug coverage. During this phase, traditionally, usually, there's always exceptions, right? But usually you are paying the most for your medicine during this phase. So this is where you're going to pay 25% of the cost of the medicine. So instead of a $1 copay or a $47 copay like you might see during that initial coverage stage, you are now going to pay 25% of the cost of the medicine itself. So on some of our more expensive medicines, that can certainly add up. Over the years, that coverage gap has shrunk, but it's not gone away. We still have that 25% that has to be paid. Now that stage, once the cost of the medicine and what you have paid now adds up to, not an additional, but on top of that $4,430, once we get to $7,050, so your copay spent plus whatever the drug costs, we now hit our catastrophic phase. During the catastrophic, the 4th and final phase of payment, you are paying 5% of the cost of the medicine. So again, it's not a flat dollar amount, but it usually ends up being one of the lower or lowest costs that you spend on that medicine at 5%. It really does vary from medicine to medicine and even somewhat plan to plan, honestly, and even pharmacy to pharmacy and what their retail costs are for that medication. That's why it's really important to do a thorough review of these plans every year to make sure you're in the right plan consistently from year to year. But that's how these Medicare Part D plans work. You've got 4 phases or stages of payment. You've got that deductible, your initial coverage, the donut hole or coverage gap, and then catastrophic coverage. That is true whether it's a standalone Medicare-only prescription drug plan, it's by itself, it's paired up with a Medicare supplement or Medigap plan, or if it's built into a Medicare Advantage plan with prescription drug coverage. Those same 4 stages exist unless there's no deductible. Again, you could skip that phase, but all the rest of the numbers and phases apply. Same with the tiers. They all have those 5 tiers, but what medications get put on a tier 1 or a tier 4, the companies have some freedom to decide that. And so it's really imperative to review these to make sure. Again, I just can't stress that enough. Prescription drug coverage with Medicare can be very tricky and really hard to navigate on your own. So it's very important to consider all the different factors that affect your cost, and why working with a trusted advisor will really help you with that. So that is how the prescription drug plans work, how they're structured, the tiers, the stages of payment, and what exactly, especially that donut hole, because it sounds so sweet. We think of donut holes and we think of something yummy, and yet with Medicare, it's a little bit tricky, and definitely the part where we spend the most on our prescriptions. So want to make sure you guys are aware of that. If you have any questions or need additional assistance, need someone to review that for you, please don't hesitate to reach out to us. You can reach us at 833-NOW-JAKE, and we'd love to help. Thanks so much and have a great day.